the last time you and I talked was right before the holidays, and we were really asking people to do different Thanksgiving traditions and really, recognize that we do have increased infections, and this is a good time to be really careful. So what we found out over Thanksgiving is there was about a 30% drop in Thanksgiving travel from a typical year. So a lot of people did change their plans and stick to their households. And, that is a good thing because we were so concerned going into the holiday about spreading infection. We won't know for a few weeks if that was enough. And there's a lot of concern that even with a 30% drop, we maybe passed around a lot of infection. Right now, the estimate in Colorado is that 1 in 41 Coloradans is currently infectious. So this is the highest prevalence, rate that we've had since this thing started. So, while we have I do want to say thanks to everybody that stayed home, but we're not out of the woods yet, right? We still have to be really, really careful the next couple of weeks.
Absolutely. And the way it multiplies with one person can infect 2.5, and within a month you're talking hundreds of people just from one case. So it's important to try to keep it contained as much as possible. Are there any new updates with with tracking, with contact tracing, anything like that?
Well, just with this high rate of infection, with that many people infectious, we do get, we'll get up to 100 cases a day locally. And if every one of those cases has 10 contacts, that's our staff calling 1,000 people a day to work through their quarantine and isolation. So, we're still reaching 1,000. We're still reaching 100% of our contacts, but we're doing some of that in an automated system right now. And I think there is a little bit of good news there. We are able to shorten quarantine periods for some people. So there's a lot of new information to come out on that. So that will help people spread less infection, but we're still in a pretty tough time right now.
Okay. Now, for people who have maybe showing symptoms or they need to get tested, maybe they did go travel and things like that, they're still doing the tests, I understand, over at the fairgrounds, but they're also going to be doing some testing out in Bayfield?
Yes, we do. San Juan Basin Public Health works with partners to do free community testing at the fairgrounds. It's open 5 days a week. And then the Upper Pine Fire Division in Bayfield does offer free testing periodically, and it kind of just depends on what the need in the community is. That's usually stood up on a Friday or a Saturday for half a day, and that's just a wonderful opportunity for folks in Bayfield to easily get tested. So all of this information is on our website. We really encourage you, if you're symptomatic, if you've been exposed, or if you've engaged in high-risk activities, please go in and get that test so we can help you and help you contain infection.
Absolutely. I know more and more people who are testing positive all over the place. One terrified me, and I do want to kind of bring that up, is that I have a cousin who's a nurse out in Texas, and Texas is a little different than we are, but she tested positive, and she was home for 2 weeks, and then she was still testing positive, and her work, the hospital, told her to just come back to work because she could still test positive even though she's negative for quite some time. And that terrifies me that would be the case, because we don't know things like that, do we?
Well, there's some interesting things with how long a person is infectious for. And what we believe in COVID-19 is that there's a infectious period about 48 hours before your viral load is high enough to test positive with a PCR test. And then your most infectious period goes a few days past that. So what does happen for a small percentage of individuals is after this 14-day period, there is some residual virus present, and that can be continued to be picked up in tests. But this is only for a small percentage of people that have already tested positive, been symptomatic, and recovered. And so for someone that's in healthcare, they are testing frequently
Mm-hmm.
if this person continues to be positive, they can go back to work because they are beyond their infectious period of this initial infection. So this stuff is really tricky, and this is why when someone tests positive, we do interviews with them and we walk them through all of the things that can happen. So for your cousin, it absolutely sounds scary, but she's working in a healthcare setting. They do know what they're doing. She's okay for going back to work. But I completely agree. Anybody that's like, I'm still testing positive is going to be really, that's going to be really hard information to get.
Yeah. I would still practice extreme caution, I think. How are we doing on beds at Mercy and other areas? Do you know how we're doing in the ICU rooms and things like that? How much room we have available?
In Southwest Colorado and across the Western Slope for the last couple of weeks, the percentage of ICU beds reported available has ranged from 0% to 1 to 2%. So the indication there is that just across the Southwest and across Western Slope, we do not currently have ICU capacity. So, and of course that changes because people get discharged, people get moved down to other units, but it's really tough times. People are getting transferred frequently out of the region. They're getting transferred, up to the Denver area. They're getting transferred to other states. That's, if you think about that, if you're sick or if it's your loved one who's sick and they're moved to someplace hundreds of miles away, that in and of itself is a pretty traumatic experience. We want to be close to people. Even if we can't go in and see them, we still want to know they're nearby while we're, wishing for their recovery.
Absolutely. Wow, 0% some places. So aside from high-risk COVID activities, it might be a good idea to avoid high-risk other activities, such as, if you can stay home, the less you're driving a car, the less likely you are to have a car accident, and that's one more bed, right?
Right. No, and that's absolutely true. That's why we talk about in emergencies, we need kind of whole of government and whole of community responses because everything's kind of connected in some way, right? We've seen this before when we've had fires locally. The city or another government agency has closed trails, and they closed the trails because they don't want someone getting hurt on the trails and needing search and rescue because all of the search and rescue folks are, doing some volunteer work to help with the fire, help with the evacuations or help with the information, right? Search and rescue doesn't typically fight the fire, but they're doing something related to it, right? So then you can't pull them from that to go do a rescue on the trails. So it's all the same type of thing. Any type of emergency, we have to kind of zoom out and think as governments, how do we share the load? As community members, how do we all do our part? And we've got to get through this period.
Absolutely. Do we know, do we have an approximate time period on this period, or it's just kind of open-ended for the whole level red?
We did start to see in the very end of November, we started to see this leveling off. Let me say that a little bit differently. We started to see the first indications that we were going to level off. The difficulty is that with the Thanksgiving holiday, and like we said, we saw a 30% drop in travel, but we don't know if that's enough. So we're still, everyone around Colorado that's in public health is studying the numbers, and the consensus is we're going to need another week or so after Thanksgiving to kind of figure out what happened. So a lot of the modeling for December right now is saying some unknowns until we figure out what happened over Thanksgiving.
I see. All right. Now, the state has reported new COVID-19 outbreaks here in La Plata County. Is that happening? There's several businesses that we have had reports of having some sort of outbreak over the last couple of months. Can you speak on any of that?
Yeah. When you look at a number that says 1 in 41 Coloradans is currently infectious, and, we think we're doing a little bit better down here, but that's a high number. So in any workplace, there is opportunity to spread infection, right? And I think you and I have talked about this before. When we're in our work and we're in the public eye, we're going to remember to keep our mask on. We're going to keep our 6-foot distance, right? Because we're better at reminding each other in that circumstance. But then when we're just, after we've locked the door and it's just us and our coworkers, or we're sitting in a break room and someone starts, oh, do you want to drink a Coke? Before you know it, the masks come off. We forget. We go back to our habits. I mean, all of these habits we have, they're brand new, right?
Mm-hmm.
So when we're in a circumstance to remind each other, we're better. When we kind of close the door and, we're alone, we revert to our old habits. It's just very normal behavior. So what that starts to produce is a lot of workplace outbreaks. This doesn't mean that someone is, doing something terrible. It means that we're just acting like human beings in our workplace after a long day. You share a meal with your coworker in the break room. If 1 in 41 of us is sick right now, someone walks into that break room, there's 5 people without a mask on and 2 get sick. Now you have an outbreak.
Yeah. Well, and one thing I did want to ask about too, we'll get going here, but the vaccine, now the UK has approved the Pfizer vaccine, it looks like, and it looks like we may be doing that before too long as well, and it seems that the Colorado public health agencies like yourself are laying out the plans for the vaccine rollout.
We are. And so this is this really tricky time. We still have to be really careful to not spread infection, and we get to start planning for a vaccine. This is amazing that we're into this pandemic in a time period that can be measured in months, right? We're 6-8 months in of working on this vaccine, and it is about to be approved, and it is about to be rolled out. So this is really just an amazing feat that this is happening. We also have to be careful, though. It won't roll out fast enough for everyone to get it at once, right? So we do expect mid-December to start getting doses. Our first shipment down here is going to be a few hundred doses, right? And then you need 2, so that's less than a few hundred people that will be protected out of the gates. We will then continue to get shipments over the next weeks and months, and we're thinking, by 6 months, there'll be enough people vaccinated that will get to make a dent in this thing. But so we want to really celebrate. This is great news, but it doesn't mean that we instantly get to go back to life before the pandemic.
Right. Yeah. It's definitely hope, which is nice.
Yes.
And to think, I mean, as long as we've all been, for lack of a better word, suffering through all of this, this is record timing for a vaccine, isn't it?
It's unfathomable how quickly this happened. Yep. And this is a new technology. And not only is it how quickly it happened, it's also how quickly it can be produced once it's approved. So this is a feat of human history that is absolutely it's great. So we do need to celebrate that with caution, which is we still have to practice infection control as individuals.
Right. Drink that bottle of champagne just by yourself. That's Zoom champagne. There you go. Yeah.
Exactly. Yep.
Well, great. All right. Well, I want to thank you so much for joining us again today. Is there anything else we want to get out there today?
No, we're just going to keep reminding people that we've reduced it down to a small phrase, which is don't share your air. So that means keep your distance, put your mask on, keep activities outside if you can, right? So we're not going to share our air. We're going to watch really carefully for the next couple of weeks what the holiday season looks like, and then we will start getting more vaccine out in the communities in the next weeks and months.
Sounds great. All right. Can we look forward to chatting with you some more updates next Thursday?
We'll see you next week.
Sounds great. All right. It's Radio Without Rules. It's 92.9 The Point. 9 The Point.